Dentistry is kind of an interesting blend of a lot of things I like to do. I've always enjoyed working with people, being a Boy Scout and leadership roles like that. I really enjoyed working with a team and putting together a group that accomplished things. And then I also love to do things with my hands. So, it's kind of a really nice fit because, doing dentistry is kind of like fine art. You sit down and you paint and you make things out of materials, sculpting and that kind of stuff. And so I really enjoy doing that kind of thing. I do a lot of specialized things in a general practice. And the nice thing about that is it allows me to dovetail a lot of things that typically would be in a lot of different areas. I do some root canals, I do implants, I do restorative treatment, I treat head and neck pain. So there's a lot of different things that really dovetail together well. The end result is that I can create a really beautiful final result and have all those pieces together under my control so that I get the result that I'm looking for and the patient's looking for. When I was in dental school, I discovered that I had a lot of neck pain. I thought I needed a root canal or something because I must have had an infection or something, because my level of expertise at that time was I was an early dental student trying to figure out what in the world was going on in my own mouth, and what it was I was grinding my teeth like a fiend. It was just like crazy. And it was very frustrating to me because I was doing a lot of damage to my teeth. I was causing a lot of pain, but I wasn't getting a solution. So I took a whole training program with a guy named Niles Guichet, a guy from California, who was really famous for creating functional dentistry and solving a lot of functional issues. And I got some relief. I actually had Dr. Guichet work on my teeth, trying to get some of these issues corrected. And what I discovered when I went to a place called the Las Vegas Institute was that the Las Vegas Institute taught this thing called neuromuscular dentistry, which actually, the design of the neuromuscular dentistry system is to get the joints, the muscles, and the teeth all working in harmony so that you don't have one beating the heck out of the other. And that's kind of the thing that was happening in my mouth, was that my bite was incorrect. My jaw was too far back and too far up. My back teeth were too short, and the end result was my muscles were having to work all the time to fight this jaw position. And once I got that corrected, lo and behold, my neck pain went away. My neck muscles were much more relaxed. I could turn my head normally, and now I can turn my head normally and everything's comfortable. And so it was kind of one of these things where I could see these problems in my patients, but I was also experiencing them myself, and so that was a big struggle for me. Head and neck pain is one of those things that's very difficult to deal with, but we certainly do fix head and neck pain all the time. We do work with headaches. We do work with restricted movement in the neck area. It's something we deal with every day because what we're doing is we're balancing out and making the body working in harmony so that you don't have all that pain.